happy Aloha Friday. It is May 22nd, 2020. I'm Ryan Kalesuji. This is the COVID-19 care conversation. Great to see all of you. Great to see you, Yunji, here. We've made it through yet another week.
Yeah, hard to believe. We've been in this lockdown mode now, safer at home. And then I think I forget what the governor has dubbed this new period, care for others, live with aloha, something along those lines. I'm putting everyone on the spot here. But we want to welcome you here to the COVID-19 care conversation. This, of course, brought to you by the Hawaii Executive Collaborative and Hawaii Pacific Health. This is really a forum for us to get together to talk about the response to the coronavirus here in the islands. And we are very excited this morning to welcome Nanci Kreidman. She's going to be talking to us about domestic violence and spousal abuse, what's happening in our homes. You know, so many people have experienced so much stress right now, whether it's financial or just physical stress or being cooped up in your home with your loved ones. For people who are in relationships that can be dangerous, this can be an especially difficult time. So we're very happy to have Nanci here from the Domestic Violence Action Center. And yes, Ingrid, it is Act with Care. Thank you for that reminder here. But we're very, very happy to have Nanci. Before we get to her, though, we want to get to the count. And again, single digits, Ryan.
That's right. 4 new cases actually reported yesterday. And again, no new deaths. So the count still remains at 17. The total number of positive cases in Hawaii now at 647. So those 4 new cases, a little higher than what we've seen in the past few days. Of those numbers, we've seen 1s and 0s and 2s. 4 has been the most that we've seen in some time. But as the governor mentioned on Monday, we can expect to see these numbers continue to go up. Dr. Starr Park also confirming that as the state begins to reopen more and more of the businesses and allowing for more flexibility in these orders, they are anticipating these numbers to go up. And they're saying that they will keep a close eye on that. They're saying not to get too alarmed and attached to these numbers until there's maybe a significant jump. And the good thing that Dr. Starr Park also mentioned yesterday, they're still able to do that contact tracing so that these cases that are being reported, they're still able to pinpoint where it originated from, which is helping them to sort of manage where it's at right now. But again, no doubt good numbers once again with 4 cases.
Yeah, and it looks like if you head to the paper today, they're talking about different ways that different businesses are opening up. It looks like restaurants on Oahu will be opening on June 5th. Parties of no more than 10. People encouraged, of course, to wear masks when they're interacting with each other. Mandated to do that, except for, of course, when you're eating. And then the tables themselves will be 6 feet apart. So it'll be interesting to see how restaurants and businesses actually implement this. We know that in Hawaii, you know, a lot of our dining establishments are very small. They're very intimate places. So how restaurants will adapt to having fewer patrons in at once, and how people will themselves feel. Do they feel comfortable actually going and doing dining in, or is takeout still the best option? So we want to hear from you. How do you feel about heading back out? And then just before we logged on, I saw a news alert flash that all 11 Macy's stores throughout the state will be opening. I believe it's tomorrow or maybe even today. So that'll be interesting, too, to see how retail adapts. They say they'll be following the CDC guidelines. Will you be trying on clothes? Will you still shop online and just do returns in the store? So, you know, we're all sort of learning and adapting in this together.
Yeah, another thing that will be opening also beginning on Saturday will be churches and congregations will be allowed to gather in person while, again, still maintaining that 6-foot distance. And some exceptions for church members, of course, that belong to the same household. So churches are sort of in this scramble mode right now that they just got the clearance. Some of them are still deciding to hold off on those gatherings, that they're not necessarily going to be able to welcome in their congregation right away. They're going to take some time, but some of them are ready to get back into it. So we'll see what happens over the weekend, how many of these churches actually do assemble and how they are going to handle this moving forward. Again, a lot of questions, and we'll continue to keep you posted as new developments and new things become reopened here in the state.
One of the people who's been having to adapt, of course, is Nanci Kreidman from the Domestic Violence Action Center. She is joining us now this morning to talk about the stresses that Hawaii families have been experiencing. Good morning, Nanci. How are you this morning?
Good morning. I am fine. I'm good, healthy, strong, and adaptive. So been very, very busy.
Please tell us about the types of cases you're seeing and the changes that you've seen since the lockdown began on March 25th.
Well, we had to make some big changes at the Domestic Violence Action Center when the stay-at-home directive was imposed. We recognized right away that people would not be able to place a telephone call, for example, with an abusive partner standing by. So we added a chat capacity and a text feature to our communications vehicles. We also made it 24 hours a day, 7 days a week. Domestic violence doesn't only occur during the week, during the workday, and when you are at home with a person who has used power and control over you in your relationship, being restrained to your household with that person is very dangerous. The coronavirus did not turn anybody into an abuser. So in spite of the references to the financial stress and whatnot, I mean, my husband didn't turn into an abuser. So we really have to recognize that the circumstances exacerbated the risk, and it also reduced the options for people who are at home with an abuser. So our work has been pretty feverish since April 1st. I have some data that I want to share. We've been a little bit disappointed that the community is not recognizing that domestic violence is a consequence of the coronavirus, just like hunger and just like homelessness and just like risk to health. Domestic violence has been a challenge in communities all across Hawaii. So in our client contacts have increased 62% in the month of April. Our safety plans have increased 70%. Our referrals for other community resources have gone up 83%. Our requests for legal information have gone up 271%. And our DV education, which is how we explain to people what the dynamics of domestic violence are, have gone up 155%. Now, when we compare April 2020 with April 2019, our client contacts were 519 in 2019. In April 2020, our client contacts were 3,038.
And when you say client contacts, is that somebody in, a victim of domestic violence? Is that a friend or a neighbor? What does that actually mean? What is a client contact?
That's a really important question. That could be a person who is already on our caseload. We have about 300 people currently on our caseload. We have a variety of different kinds of programs. So we have legal services, we have on-site court outreach. So every person who's getting a temporary restraining order has the benefit of seeing somebody from DVAC on site in Kapolei and at Circuit Court on Punchbowl Street. So client contacts would be the survivor herself, a family member, somebody at court, somebody calling our helpline. Although our helpline calls went up from 692 in 2019 April to 1,066 in April 2020. So we're seeing a steady increase. We've been comparing our data from week to week. The longer this goes on and the more that danger increases, the more people are reaching out for help.
Nanci, we've heard from the Honolulu Police Department, who have said, when asked about this question in the past, have said that they haven't seen, on their end, they haven't seen number of calls made to the police department, say, reporting any sort of domestic violence. Do you think that this is because people are just afraid to call police? And what is sort of the scenario in that case that may lead to more people calling and seeking your assistance than calling the police themselves?
The police are not necessarily allies in every community. Indigenous communities, immigrant communities may not reach out to law enforcement. when people need help with safety planning or decision making or options, they might call an agency like the Domestic Violence Action Center, and they might not call the police. It's very hard for us to understand the chief's assessment of contact with law enforcement. We do know that police are going out to domestic violence calls and maybe not writing reports or not calling it domestic violence. They might go out and make a report which goes into a category called miscellaneous public, so it doesn't get captured as a domestic violence crime. Or they're going out and encouraging the perpetrator to go for a walk or stay away from the premises for 24 hours or 48 hours. They might not be capturing those as domestic violence. So we're a little confused by that, honestly.
What advice do you have someone who might be in a dangerous situation right now, someone who might be watching this and really because of COVID feels like they have nowhere to go?
Yeah, that's very, very important. One of the things that we made a commitment to doing at the outset was letting our community know that the Domestic Violence Action Center and all other domestic violence programs are active and accessible and ready to help. So if you can't make a telephone call, you could text us or you could chat. A lot of people working at home, they have their laptops open. They can be going to our website and chatting with us. We want people to know that there are options and that we would help them develop a safety plan, which is a blueprint for what to do if danger arises. Sometimes when you're in crisis, it's difficult to figure out what you're going to do in the moment because you're in crisis. But if you've thought it through before that crisis occurs, you can just implement the plan. Some ideas like don't go into the kitchen, don't be in the kitchen where there are knives and weapons. Don't go into a bathroom where there are a lot of hard surfaces or water. And then there are other things that we would guide a person to think about based on their circumstances, because every situation is not the same. So we want a person to think about what would they do if they see escalating behavior. There's also the idea that person could make contact with a family member or a friend or a neighbor and develop a code word or an emoji and symbol that they could transmit if they're in danger and they need help. So we would encourage people to think kind of outside the box about reaching for help and communicating their need for help.
You know, oftentimes teachers in schools are able to see and see the signs of domestic violence within abuse of children or anything like that. They sort of have been trained to sort of look for some of those things. And with school now not in session and teachers not able to see students, have you seen or have you heard any reports of those types of the impact that that has had and the disconnection, I guess, between teachers and students and how that could be impacting the organization such as yourself?
We're very concerned about the safety of children as well. You're exactly right. There are no other eyes outside of the household being able to discern or detect a problem. We don't get calls about child abuse specifically. Our callers are making inquiries about family violence, which could include domestic violence. And certainly we are making recommendations and including children in safety plans. But without the ears and eyes of the community, we're at a great disadvantage for helping children and helping survivors. When survivors go to work or go to other places like churches or other places where they congregate, they can get help. If they're at home, it's much more difficult.
If someone is watching this and they may be concerned about a relative or a friend, someone that they know that might be in a dangerous situation, what is the best way to reach out? I think a lot of people can be a little bit afraid about offending someone or perhaps triggering an abuser. How to best navigate this, especially when someone might not be alone or, have privacy from their abuser?
Right. The other thing we did at the beginning of this stay-at-home directive was to really encourage people to reach out with a listening heart and offer support, name it. It used to be people would want to ignore it or minimize it, act like they didn't see something, not wanting to jeopardize a friendship or create a problem where they weren't certain it existed. At this point, we really want to encourage people to call and say, I've been concerned about you. How are you? Do you need any help? There are resources. Can I give you some telephone numbers? Here's a website. Just talk about it and give people permission to acknowledge that they're afraid or they are in danger.
We're getting some questions from the audience, and Mindy wants to know if your organization has received any CARES Act funding. When you have an increased volume such as that, I'm sure that you have a lot of work and you could probably use more help. Or have you been getting any kind of state or federal relief right now?
We haven't received any CARES Act funding yet. We sure hope to. We have articulated the need and the demand and the concerns and the cost and transmitted that information to our state agencies and to the legislature, the Women's Caucus, the Women's Legislative Caucus. I feel pretty hopeful, but the demands are many and the competition is fierce. We have received a great deal of community support. The Harold K.L. Castle Foundation called us and said, do you need help? And of course we said yes. The Clarence T.C. Ching Foundation contacted us and said, do you need help? And we said yes. Aloha Care contacted us and said, do you need help? And we said yes. Summit Media contacted us and said, we are going to adopt you for the months of April and May. Their online on-air personalities all day long are talking about domestic violence in the Domestic Violence Action Center, driving people to our website and to their Facebook pages to make contributions. So there's some recognition in our business community and in our funder community that it's a likely outcome that living with an abuser during a time like this is going to result in increased danger, and we are enormously grateful for that.
Now, it's great to hear the support that's coming in your way. Final question is, I guess, if people want more information on this, if they want to find out how they can potentially help someone else that they know, where should they go? How can they get more information from you folks?
Well, they're certainly welcome to call our helpline and ask direct, specific questions. They can do that confidentially and anonymously. Our text and our chat is also available. Our website is www.domesticviolenceactioncenter.org. Describes all of our programs, illustrates the power and control wheel. I mean, all of domestic violence is not physical. There's many different kinds of abuse that people are experiencing. We are getting a lot of chat from people saying, I think I'm in a domestic violence abuse situation. I never really thought so before, but I feel like it now. So ask questions and seek information and know that we are here to help.
I know that Ryan said that was the last question, but I just had one more. And that was right at the top. You said that, COVID doesn't necessarily turn someone into an abuser, but obviously you see the uptick, and what you just described is very interesting. What is it specifically about, this circumstance that is bringing that out, that you're seeing these increases?
Well, when you are trapped at home with somebody who resorts to using power to control you, and you have no options, they're not going to work, you're not going to work, you're not socializing, you're not going to church, you're not leaving your home, you are a prisoner of that person who exercises the power and control over you. 24 hours a day, 7 days a week, with no respite from it. So that, I think, accommodates and informs our understanding that you can expect to see more instances of verbal, emotional, physical, sexual, tactical abuse.
Okay. Again, the website is domesticviolenceactioncenter.org. You can find all the resources there, including some information to figure out if you could be in this situation yourself. As Nanci was talking about, people who suddenly realize that the situation that they're in is not healthy. So we so appreciate all the work that you're doing for our community, and thank you so much for giving us your time this morning.
We're happy to be here. Thank you for having us.
Thank you. Aloha.
So important to hear that, and so important also to highlight that domestic violence does not necessarily, an abusive relationship does not necessarily mean it is a physical one. So please do check out her website. And if you know someone who might need to see this, share this on your Facebook page. Spread this information far and wide. You never know if somebody is in a dangerous situation and could really use this lifeline of support.
Yeah, I think quite staggering the numbers that she was sort of reading off, comparing the situation now and the numbers and cases that they're seeing compared to this time last year. So certainly those numbers speak volumes into the need of organizations and community-based support like what they provide there. So thank you to Nanci Kreidman and to everyone there that continues to provide this important service in our community.
Some other highlights from the paper today. Lawmakers are moving to take the COVID relief money and put it into the rainy day fund. There's a lot of back and forth between lawmakers and the governor's office. Next week, we are going to have the lieutenant governor along with some lawmakers. Scott Psyche is going to be here. So we'll see if we can get into some of this and figure out what they're planning to do with that money and why they've taken this route. Yeah,
a lot of some criticism coming within the legislature themselves. There have been some vocal members in the Senate and a few in the House that have spoken out against this idea of using the CARES Act money and some of the federal dollars and placing it into the rainy day fund. Of course, the administration has also made note that some of the money that is being put aside can't necessarily be saved for years to come and that it has to be used by the end of the year. But the legislature's thought behind this whole idea is that we could be in this situation for some time, and they want to prevent and have sort of a cushion for more financing and for more funding to support projects and programs and services in the years to come. But other lawmakers and other people in the community are saying people need it right now. So there is a lot of debate happening now. We would love to hear what you think about this. And of course, we will talk to Speaker Psyche next week to get a better idea of the plan for this and some of the decisions that were made that led them to decide to move this into the rainy day fund.
Another dubious distinction, Hawaii could be number one or number two when it comes to nationwide unemployment numbers. We're expecting to get that statistic out today. There's an article in the paper just about how rough the unemployment situation is here in the islands, record high levels in April. If you or someone you know has not received benefits or has questions about benefits, Scott Murakami is going to be here on Tuesday, as he has been every Tuesday for some time now, to answer more of your unemployment questions. We go through as many as we can and try to get to a lot of them. So please join us on Tuesday for a conversation with Director Murakami if you have specific questions about resolving some of those unemployment issues, because we know there are tens of thousands of people who have still not seen any benefits.
Yeah, and those numbers, again, could go up as this first wave of PPP is coming to an end in the middle of June. And so a lot of these businesses saying they were able to stay afloat with the funding and able to employ some of their workers, but come middle of June, they may not be able to sustain that paycheck and be able to support some of their employees. Thus, we could potentially see an increase again in even more unemployment numbers. And so we're going to talk to the director more about how the state is potentially planning for this second wave of unemployment benefits that will potentially be coming in, and how the system is going to be prepared for potentially another influx of people looking for unemployment benefits.
Yeah, some rough numbers there, but we always like to end with some good news, and that is highlighting Hawaii Hero. We have two to present to you today. The first, an anonymous donor surprised hundreds of kupuna at Foodland and Sack and Save, along with Foodland Farms. You see it right there. Cashiers notified nearly 2,000 shoppers at checkout that their groceries were covered for the day. just wonderful to see. Mahalo to whoever that anonymous donor is. Just really incredible to present people with that secret surprise. I think not only is it wonderful because, you know, the money itself, but also knowing that there is somebody in our community who is willing to extend themselves so generously. I'm sure that was very much appreciated. So we love to see that. So mahalo to that anonymous donor, whoever you are. And then the other thing that we want to do is highlight EMS. It's EMS week, and we really appreciate all the amazing things that Honolulu EMS does for our community and emergency responders throughout the state. We salute you. They are our heroes, and they have been doing so much throughout COVID. In handling COVID calls and then the regular response calls. So we salute them. You may have seen Honolulu Hale, if you happen to go by there, lit up in the evenings. And that, of course, is to highlight EMS week.
Yeah, a lot of heroes in our community that we want to highlight and thank. So we thank everybody. Sorry for this. I'm trying to, there you are.
Here I am. We're always still learning this technology. We appreciate all of you being with us, of course. Thank you so much for joining the conversation. Again, as soon as we log off, that live stream can be shared. And this one in particular is something that we really encourage you to share throughout your network, because again, you never know who might need to hear what Nanci had to say about being in an abusive situation. You know, you can't necessarily call everyone in your network, or maybe you don't feel comfortable, but this is a way to highlight that, you know, give them information that they could use right away.
That's right. And again, we want to remind people that happening right now, there also is a food drive. The distribution at the Aloha Stadium continued. The stores stadium opened at 10 a.m. Again, on Wednesday, we saw a number of cars once again being lined up as early as 7 a.m. to get in line for these food items. So again, this will continue on through the rest of this month. So about a week left, and then they're going to sort of reassess to see how the distribution plans are going to be moving forward through the month of June. But again, this food distribution happening right now at Aloha Stadium. For more information, of course, head over to the food bank for more information about how you can provide support or potentially get food and support from the food bank themselves. So again, mahalo to them for all their efforts as well, for what they're doing for our community.
It's a holiday weekend, although all the days seem to blend together, but it is a holiday weekend. So happy Memorial Day to all of you. That's coming up on Monday. As you do venture out, be safe, wear a mask, wash your hands, social distancing, physical distancing, all of those things really do help. We have such good numbers in Hawaii relative to the coronavirus, and we don't want to lose that momentum. So thank you to the community for all you are doing to keep each other safe. And until we see you again, we wish you a very good weekend and a fond aloha.
Aloha. We'll see you next week.